Parenteral. It derives from the Greek word para, that means outside, and entron, which means intestine, and denotes routes of administration other than oral route. Injections are sterile, pyrogene-free, that means endotoxin units limited, preparations intended to be administered parenterally. Pyrogenes or bacterial endotoxins are organic metabolic products of living microorganism or the dead microorganism which can cause fever and hypotension in patients when they are in excessive amounts in intravenous injections. When we need to administer the drug parenterally, we need to administer the drug parenterally when the patient, for example, is unconscious, or when the patient is uncooperative, or during emergency condition, or if the drug is inactive when administered by another route of administration. Official types of injections. First, we have the first type, which is called injection. These are liquid preparations that are drug substances or solutions. Example, insulin injection USB. The second type is for injection. For injection is a dry solid that upon addition of suitable vehicle yields solution conforming in all respects to the requirements for injections. Example, we have cefuroxime for injection USB. Third type is injectable emulsion. Injectable emulsion is liquid preparation of a drug substance dissolved or dispersed in a suitable emulsion medium. Example, propofol USB. Injectable suspension is a liquid preparation of solid suspended in a suitable liquid medium. Example, methylprednisolone acetate suspension USB. Finally, the other type is for injectable suspension, which is a dry solid that upon addition of a suitable vehicle yield the preparation, conforming in all respect to the requirements for injectable suspension. Example, we have imipenem and cilastatin for injection suspension USB. This figure represents the first type, which is injection. It is insulin injection USB. This is cefuroxime for injection. This is propofol, which is injectable emulsion. And this is prednisolone acetate, which is injectable suspension. This is imipenem and cilastatin, which is for injectable suspension. Parenteral routes of administration. First, we have intravenous route. The IV drug provides rapid drug action compared with other routes of administration. Why? Because the drug is administered directly to the systemic circulation. It does not need absorption throughout GIT membrane, for example, when it is administered orally. Optimum blood level may be achieved with accuracy and immediacy. It is also regarded as life-saving in emergency condition because the drug is administered directly to the systemic circulation. On the negative side, once the drug is administered intravenously, it cannot be retrieved. Unlike the oral route, when the drug is administered orally, it can be easily removed by induction of vomiting. Also, the IV dose may differ greatly from the oral dose. For example, in case of metoprolol, in case of this drug, the IV type of this drug, the dose is 5 milligram in a 3 bolus dose for 2-minute intervals, while if it is given orally, the dose is about 100 milligram per day. Also, both small and large volumes of drug solutions may be administered intravenously. For example, in the hospital, you can see about 1000 milliliter container of the solution, which is used for intravenous infusion, for replacement of plasma volume, or for electrolytes, administration, amino acid, and other nutrient. Also, the drug should be in aqueous solution to be administered by IV route because they must mix with the circulating blood and not precipitate from solution. This figure represents different routes of drug administration. The IV route, which is administered directly to the blood vessel, intramuscular route, subcutaneous route, intradermal route.